Welcome to our video about esophageal candidiasis. If you suspect that you have esophageal candida, it's time to see your doctor. This article will discuss the symptoms, diagnosis, treatment, and prevention of this condition. To be sure that your doctor can effectively treat your case, he or she should review your medical history. Listed below are some of the most common symptoms and treatments for esophageal candida. These treatments are generally not life-threatening and will help you avoid the condition in the future. Symptoms: patients who have candida esophagitis usually experience retrosternal pain and dysphagia. Patients may also experience oral thrush. Imaging studies are not useful for establishing the diagnosis but can confirm it if esophageal candidiasis is present. Symptomatic treatment may include systemic antifungal medications. X-ray barium examination may reveal abnormal peristalsis at the upper and lower esophagus. The main symptom of esophagitis is pain while swallowing. However, some people have no difficulty swallowing. Additionally, the condition can cause ulcers, swelling, or irritation. The pain and irritation associated with an esophageal infection may be the result of a herpes simplex virus or a cytomegalovirus infection. However, if you are experiencing any of these symptoms and think you may have esophageal candida, you should visit a doctor. A diagnosis will be made only after a thorough examination. Some people are at risk of developing esophageal candida because their immune systems are compromised. This condition usually affects people with AIDS but is not limited to cancer patients. Infection in the mouth may also occur in people who are on certain medications or are pregnant. Some people with these conditions are also at risk for esophageal candidiasis. In addition to the esophageal candida symptoms, those with diabetes may also have a higher risk of getting the infection. Since diabetes can lead to excessive sugar in the saliva, uncontrolled diabetes can damage the immune system. In the retrosternum, the most common symptom of candidal esophagitis is pain. Patients with concurrent oral thrush may experience nausea or vomiting. Dysphagia is a lesser-known symptom. Patients with an HIV infection may develop esophageal candidiasis as well as esophageal thrush. However, patients with an immunosuppressive drug may also suffer from symptoms of esophageal candidiasis. Treatment for esophageal candida is highly effective in acute cases. Patients with non-responding to initial therapy should consider the possibility of resistance to treatment and undergo an endoscopy. Prognosis depends more on underlying comorbidities. It is not advisable to prescribe antifungal medication for patients who have had recurrent episodes of esophageal candida. Diagnosis: infectious esophagitis is a very common ailment affecting the esophagus. Candida fungi infect the oropharynx and alimentary canal. Patients with weakened immune systems are most likely to be infected with candida. Approximately 20% of the general population is infected with candida, with a higher incidence among people with immune system disorders and severe immunodeficiency. Symptoms of esophageal candidiasis are similar to oral thrush. The endoscopic examination will reveal the presence of white plaque-like lesions adhered to the mucosa of the esophagus. The diagnosis of candida infection in the esophagus depends on the type of candida infected. In acute cases, the candida fungus causes a sudden, severe inflammatory reaction. In subacute infections, esophageal stricture and pseudodiverticulum may develop. Chronic infections are characterized by the persistence of candida throughout the patient's life, often resulting in a submucosal fungus infection. Fortunately, a variety of strategies and interprofessional collaboration are available for diagnosing candida in the esophagus. Combined care and multidisciplinary collaboration have been shown to improve outcomes for patients with esophageal candidiasis. Impaired immune response and weakened cell-mediated immunity are the two main risk factors for opportunistic esophagitis. Symptoms of esophageal candidiasis include pain while swallowing, a burning sensation, or ulcers. Other symptoms may include irritation and swelling of the esophagus. The candida fungus is the cause of heartburn and ulcers in the stomach and duodenum. The infection is treated by suppressing the secretion of gastric acid or antibiotics. For more serious gastroesophageal complications, a proton pump inhibitor procedure is necessary. Diagnosis of esophagesis involves a biopsy, which may reveal multiple white patches in the esophagus. It is more common in people with impaired immune systems. People with weakened immune systems are more likely to develop serious complications, and multiple medications may not be effective. Patients with weakened immune systems may have oral or throat thrush, which can also affect their overall health. Treatment for esophageal candida involves antifungal medicines. These medications can be either systemic or topical. Fluconazole is the most commonly used systemic antifungal medication. It is taken orally or through a vein. There are other medications available, such as voriconazole. The most effective treatment for esophageal candidiasis is one that improves the general condition. Treatment. The symptoms of candidiasis in the esophagus and mouth are often not apparent until the condition becomes chronic. These symptoms may also be due to dehydration, acidosis, or electrolyte disturbance. Treatment for candidiasis should target the overall health of the patient and strengthen the immune system. Treatment also includes the treatment of any underlying diseases. Treatment for candidiasis begins with the discontinuation of immunosuppressive drugs and broad-spectrum antimicrobial agents. However, in some cases, antifungal medications may be sufficient without the use of endoscopy. A diagnosis of candidiasis can be made using imaging studies or mucosal biopsy. In general, the distal third of the esophagus is affected by esophageal candidiasis. Mucosal biopsy can also reveal the presence of yeast. Candida cultures may also be positive. Treatment for candidiasis depends on the underlying comorbidity of the patient. People with compromised immune systems are more susceptible to esophageal thrush. The most common risk factor is AIDS. 20% of cancer patients develop esophageal thrush. Another risk factor is diabetes, which increases the sugar content in saliva. Uncontrolled diabetes can also damage the immune system. As a result, treatment for esophageal candidiasis should be focused on reducing the symptoms. Although the effectiveness of antifungals for candidiasis varies, one type of antifungal medication may be effective for some patients. Generally, fluconazole is recommended for those with a history of exposure to antibiotics. If the infection is suspected, an alternative antifungal medication called echinocandin B-deoxycholate should be prescribed. This treatment is suitable for patients who have severe symptoms or if other antifungals are not tolerated. Fortunately, antiretroviral therapy has reduced the incidence of oropharyngeal and esophageal candidiasis. However, some individuals are refractory to fluconazole, requiring systemic antifungal treatment. This therapy involves oral and intravenous fluconazole administered over 14 to 21 days. The treatment duration depends on the severity of the infection and the extent of the infection. Prevention. In recent years, esophageal candida has become more prevalent, particularly in people with compromised immune systems. Candida infection occurs when the host's normal immune system is compromised by immunosuppressive drugs, radiation therapy, or AIDS. Nonetheless, a number of preventative measures are available to help prevent or treat this condition. Here we review a few of these strategies. We will also review some of the most important evidence-based guidelines. If you suspect that you have esophageal candidiasis, you should consider a course of fluconazole, an antifungal medication. If your symptoms don't improve, they may be esophageal candidiasis. If you've had esophageal candidiasis before, consider fluconazole treatment. However, it is important to remember that antibiotics are not a cure for esophageal candidiasis. To avoid developing esophageal candida, try to limit your sugar intake. Try to maintain good blood sugar control. This will reduce the amount of sugar in your saliva. If your blood sugar is not well controlled, this will encourage the growth of candida. But even if you're able to eliminate all sugary foods, you should still limit your intake of these foods. You'll likely develop esophageal candida in your lifetime. Preventive measures should address the risk factors and provide relief from symptoms. Proper diet and hygiene are key to esophageal candida. Change your diapers frequently and keep the area clean. You should use antibiotics only when they're truly necessary, as they often lead to fungal infections. Also, follow your doctor's orders. Asthma and diabetes are risk factors for candidiasis, so it's imperative to follow all directions. Proper treatment is crucial to preventing esophageal candidiasis. If you have a compromised immune system, candida overgrowth can lead to serious health problems. Candida is the cause of many esophageal disorders. Even when it's caught early, the fungus can spread to other organs, including the lungs and esophagus. Left untreated, esophageal candidiasis can lead to death. Thanks for watching. Please like, comment, and subscribe if this was helpful.